Hello, this is Dr. Welgan again. Thank you for following along with me in this journey. We've reached a point here where I want to pause. You'll remember I have spent the last several sessions talking about habits, how habit patterns are formed, how they're maintained, and how they are extinguished or eliminated from one's own behavioral repertoire. I've talked to you a little bit about habits in association with some work I'm doing in obesity, but I think in order for you to really understand the general direction I'm going as a research psychologist, I'd like to pause a moment and step back a few steps and reintroduce you to the field that has been of some interest to me. And that is behavioral medicine. If you remember early on in our series, I had discussed with you the relationship between psychology and medicine and how they overlap, and that area in which psychological factors affect physical function in order to produce what appears to be a medical condition has always interested me. How people acquire the ability to produce a dysfunction in the organ system that does not have a disease basis to it. In other words, a medical etiology. The study of that, in part, is behavioral medicine. There are other components to this whole field of behavioral medicine, but at the basis, how it actually evolved as a field came out of some of these very issues. Now, I'd mentioned to you earlier, I'd like to restate that, and that is behavioral medicine in this regard has something to do with psychosomatic medicine. I'm sure you all know something about psychosomatic medicine. You know the term? You probably know the general notion behind it. And that is medical disorders that are evident in people who, once again, have no medical basis for the condition and have been deemed to have psychiatric problems that produce this condition. Psychiatric problems. There must be something wrong with you psychologically. You're different from the rest of us. You've got something going on in your mind that most of us don't understand. You're weird. How can you actually produce a medical condition like yours and your doctor tells you it's all in your head? Go and see a shrink. Most physicians, recognizing that you have a psychosomatic disorder, attempt to accommodate you as a patient and try to treat the symptoms. It isn't long, I would imagine, that your physician realizes that, you better go and see somebody else here to take care of the psychological problems that you have, okay? So that's what usually evolves. I can't do too much about it, can't help you. Go and see this guy, okay? Either a psychiatrist that will give you medications. By the way, I don't think there's a medication for that condition, but go and talk to him anyway. Or you come and see a clinical psychologist and try to straighten out your head, so to speak. Anyway, psychosomatic medicine. It's evolved these days Currently, there's an enormous amount of information on the biological processes that underlie the psychological impact of that the mind can have on the body. But that link between the mind and the body remains relatively elusive. How does the mind create a condition, train the body, if you will, to produce dysfunction? It's quite interesting for me. There are many psychiatric and psychological theories that have been propounded by a wide array of theoreticians about how you end up with a condition like that. But I must say, most of them are theories. They attempt to employ the theory to produce changes physiologically. And most of them are still what I would call not very scientifically well established. In other words, sometimes you get better, sometimes you don't. And we're in a field here that is still somewhat shrouded in mystery. Well, that's what interested me as a learning theorist. Okay? Why do we have these disorders? To begin with, I think that is a fundamental question that all of us in this field and you as a general public may well be asking or should ask. God, why do we have these things? Why do we, who needs them? Okay. There's a wide array of these conditions, by the way, and we can talk about that later. In my introductory session today, that leads us into a discussion of how we actually may learn how to create these conditions in our body, is preparatory for the next series of discussions I'm going to have with you. In other words, coming out of learning theory laboratories, I think we may have an explanation. Okay? And that's what drew me into this field. That there may be a missing link here that other theories, quite frankly, have, I believe, missed. And when this association was made between what we know in the rat labs and what we know here, we begin to see how we learn and how organ systems learn. So with that introduction, what I'd like you to do is to join me tomorrow in our next lecture on how we learn to get sick. Okay? Good. I'll talk to you tomorrow.